an innovative treatment for traumatic brain injury, and how a piece of dental gear became the key to a better night's sleep. This is the Regional Health Report. Welcome to the Regional Health Report for March. I'm Ann Krebs. This month, 2 stories from Fort Gordon, Georgia. Up first, a story conducted at Eisenhower Army Medical Center shows impressive results treating traumatic brain injuries using a surprising treatment.
Traumatic brain injury, also called concussion, varies in severity, but can leave people with symptoms ranging from headaches to memory loss to sleep and mood disorders and more. The symptoms usually go away in a couple of months, but they can linger. When he started working for the Army, Dr. John Rigg noticed that symptoms can affect soldiers differently than civilians.
The difference between getting a concussion in theater that occurred when their vehicle got blown up and their gunner might have gotten killed in the event, or they were on foot and they were in a firefight, maybe a rocket landed, blew them up, killed their buddy, or a suicide bomber exploded in front of them, that the trauma of that event had an impact on propagating, promoting, maintaining the symptoms of TBI. If we look at the symptoms of concussion, mild TBI, headaches, memory, sleep, and mood issues, well, there's other things that cause headaches, memory, sleep, and mood issues, one of which is stress.
Transcendental meditation, or TM, is a relaxation technique that quiets the mind, reducing stress.
And because the mind and body are very intimately connected, when the mind settles down, the body gets a very deep state of rest, even comparable to deep sleep, and that facilitates release of stress.
Transcendental meditation has been used at Eisenhower to treat TBI and post-traumatic stress disorder for 6 years. The clinic recently published a study that showed a nearly 84% reduction in psychotropic prescriptions for their patients who practice TM.
I feel that we have a cutting-edge treatment for PTSD and TBI. And this program really is shining the light for other TBI clinics around the country to follow.
Eisenhower TBI clinic patients meet with a team including a psychiatrist, a social worker, a nurse case manager, and occupational, physical, and cognitive therapists. The team uses appropriate treatments to tailor a treatment plan to each patient. For the Regional Health Report, I'm Craig Coleman.
The study and treatment at Eisenhower is part of the Army's comprehensive program to prevent, treat, and track concussions. March is Traumatic Brain Injury Awareness Month. Sleep and readiness go hand in hand. Next, we see how Army medicine contributes to better sleep through dentistry.
Sleep apnea is a serious health threat. It is also very common. The disorder causes pauses in breathing during sleep. These pauses can lead to high blood pressure, secondary stroke, and diabetes. Many people are unaware of the possible real effects of sleep disorders.
If you don't get enough sleep, you don't think clearly. You don't make good dietary choices, you don't feel like exercising, you don't get your work done, you're inefficient, you're not attentive, and you may fall asleep inappropriately. Those are all not good things for anybody, soldiers included.
The Sleep Clinic uses sleep studies to recommend personalized treatment for sleep disorders, including sleep apnea. When education and CPAP machines are ineffective, Jaslow may prescribe a dental device or prosthesis that can help.
And so what this device does is it brings your jaw forward, the tongue is hooked onto the base of the jaw, bring the jaw forward, and air moves better, even when you're on your back. It doesn't have to be perfect. But if you move air effectively, then you maintain sleep and you maintain your oxygen state.
The patients get the device, similar to a sports mouth guard, through the Army Dental Lab at Fort Gordon.
We receive impressions or a digital scan of somebody's mouth, and from there we either fabricate the prosthesis here or we will send it out digitally to an outsourced lab.
The Dental Lab, the only one in the DoD, distributes the custom-fitted device to patients. Jaslow warns that people who do not get enough quality sleep believe what they get is sufficient.
They did this study once where they took people and they sleep deprived them, and they tested them, some cognitive test, and they didn't do well as they did when they were rested. And they kept sleep depriving them, and over the course of the week the patients felt that they actually had adjusted to insufficient sleep, but they hadn't. So as far as a readiness piece for soldiers, you can't, it's not true. It's a fallacy to think that you're going to be able to function on minimal sleep for more than 1 or 2 days.
Whether the treatment is education, a CPAP machine, or a dental appliance, treatment for sleep apnea and other sleep disorders can improve your health and your quality of life. For the Regional Health Report, I'm Ronald Harris.
National Sleep Awareness Week is March 11 through 17. In other news around the region, soldiers at Fort Campbell, Kentucky, Warrior Transition Battalion are using music as part of their recovery. The 101st Airborne Division Band and other volunteers are helping wounded, injured, or ill soldiers to learn or relearn to play keyboard and guitar. The 3 hours per week of music lessons help with hand-eye coordination, motor skills, and concentration. That's the Regional Health Report. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, Flipboard, Pinterest, and YouTube. We're also on iTunes. Thanks for joining us.